Hello everyone, myself Dr. Shikha Sardana, practicing fertility consultant at Milann-Laimaa. When it comes to pregnancy and fertility, there are a number of wide prevalent myths. But when you are trying to conceive, it's very important for you to separate facts from myths, especially since believing some of these myths can hold you back from getting the care and fertility treatment that you need. So let's clear up some of the common myths regarding fertility and pregnancy in this Mythbuster session today. Come, let's separate facts from fiction. The first myth: it's usually the woman's fault if she can't get pregnant. Well, infertility affects men and women to the same extent. Usually, there is a female problem in 30% of the cases, male problem in another 30% of the cases, and in the remaining cases, the cause either remains unknown or there can be a combination of male or female factors. So it's a complete myth that it's usually only the woman's fault if she can't get pregnant. In any case, whatever be the cause and whoever is affected, it's important for you to not to blame yourself or feel guilty. In today's world, there are a lot that you can do to help yourself to get pregnant. Many causes of infertility are now treatable today, or at least something can be done to improve your chances of conceiving. So do not lose your confidence, rather understand the condition and seek expert help. Then another common myth: you need to wait for at least 3 months after stopping birth control pills before you can start trying to conceive. Well, if you consider this true, you will simply waste your 3 months. To debunk this myth, you need to understand that the birth control pills prevent pregnancy by suppressing ovulation. The chances of pregnancy once you stop these medications depend upon the resumption of ovulation, which is quite variable. It can take from a few weeks to a few months. This depends on factors like your personal health, the type of pill you had taken, and for how long have you taken it. These all are the things to consider. Generally speaking, ovulation will resume in 2 to 4 weeks to a few weeks' time after you stop the pill. So obviously you can even get pregnant right away after stopping the birth control pill. In fact, about half of the women get pregnant in the first 3 months, and most women get pregnant within the initial 12 months after stopping the pill. So I hope it is clear now that there is no need to wait for 3 months after stopping the pill. Next myth: if you had a miscarriage in the last pregnancy, there is an increased risk of having another miscarriage. This is just a myth. In fact, the overall risk of miscarriage in women, that is 20%, is not increased in case if you had one miscarriage. Most miscarriages are a one-off, and there is a very good chance that your next pregnancy will be successful. If we talk about recurrent miscarriages or recurrent abortions, or that is 2 or more abortions back to back, then take relief, as just a small number of women, just around 1%, experience this, what's called recurrent pregnancy loss. So keep yourself calm. Most likely you will go on to have a next healthy pregnancy if you had one miscarriage. The next prevalent myth: if you have one ovary, you ovulate only once in 2 months. Well, the fact is that if one ovary is removed, the remaining ovary will compensate for the one that was removed, and that is why the women with one ovary ovulate monthly, and thus they get their menses monthly. Fortunately, because of this monthly ovulation, all other things being equal, women with one ovary don't have a lower chance of getting pregnant if we compare with women who have 2 ovaries. However, it all depends on why the ovary was removed. The underlying conditions like endometriosis will affect fertility in its own way. But conclusively, what we can see that in most of the cases, women who have only one ovary will have normal menstrual cycle, can still become pregnant, and do not experience any symptoms of hormonal changes. Next myth: you can diagnose implantation or pregnancy from cervical changes. Well, after conception, the changes in cervical mucus may be a very early sign of pregnancy. The mucus becomes thick, gummy and clear after implantation, And additionally, there is a noticeable change in the feel of cervix during pregnancy. But are these a reliable pregnancy test? Well, cervical changes always occur during early pregnancy, but it is difficult for many women to detect these. Because of this thing, it is not a reliable method to detect pregnancy. It's always better to confirm the pregnancy with a pregnancy test, urine pregnancy test or beta-HCG in case if you have missed your periods. Well, these are the common prevalent myths about fertility and pregnancy, and I have tried to debunk them. I've tried to separate facts from fiction. Thank you for watching the video, and if you found the video helpful, please don't forget to click the like button and also subscribe our channel Milann the Fertility Specialist so that you can be updated about all the videos that are coming ahead, in which we will try to cover the various fertility topics. For any further query or assistance, you can call us at the number shown, or you can come and meet us in person at our center, Milann the Fertility Center. Thank you.